Per Exam 2026 Canadian Practical Nurse Practice Test and Review, 30 Tricky Questions. Question 1. A practical nurse, PN, is assigned to a client with AC difficile infection. Which action is most important? Use alcohol-based hand rub. Wear a surgical mask. Wash hands with soap and water. Keep the door closed at all times. Soap and water are required because alcohol does not kill C. diff spores. Question 2. A PN notices a colleague is documenting care that was never provided. What is the first action? Report to the regulatory body. Speak to the colleague privately. Report to the nursing supervisor. Ignore it if the client is safe. The PN has an ethical and legal duty to report professional misconduct or safety concerns to their manager. Question 3. Which client should the PN see first after the morning report? A client requesting pain medication, 3/10. A client with a blood glucose of 3.2 mol/L. A client needing a dressing change. A client ready for discharge. 3.2 mol/L is hypoglycemic and requires immediate intervention. Question 4. The PN is caring for a Japanese-Canadian client. The family is very quiet and avoids eye contact. The PN should force them to make eye contact. Recognize this may be a sign of respect. Ask them why they are being rude. Request a translator. In many cultures, avoiding eye contact is a sign of respect for authority/healthcare providers. Question 5. A PN administers the wrong dose of medication. What is the priority action? Complete an incident report. Notify the physician. Assess the client's vital signs. Inform the nurse manager. Client safety is the priority. The nurse must first assess for any adverse effects. Question 6. The PN understands that informed consent is primarily the responsibility of the nurse, the healthcare provider performing the procedure, the hospital administrator, the client's family. The physician or practitioner performing the procedure must obtain informed consent. Question 7. Which is a sign of compassion fatigue in a nurse? Increased productivity, emotional exhaustion and cynicism, improved communication, seeking more overtime. Compassion fatigue involves emotional and physical erosion from caring. Question 8. A client has a living will that states no intubation. The client goes into respiratory arrest. The PN should intubate anyway to save a life. Call the family for permission. Follow the advance directive and provide comfort care. Start CPR and then decide. Advance directives must be honored if they are valid and apply to the situation. Question 9. When using a walker, the client should move which first? The walker, the affected leg, the unaffected leg, both legs together. The sequence is walker, then affected leg, then unaffected leg. Question 10. A PN is teaching a client about a low-sodium diet. Which food should be avoided? Fresh broccoli, canned soup, brown rice, grilled chicken. Canned foods are notoriously high in sodium due to preservatives. Question 11. What is the PN's role in evidence-informed practice? Conducting primary clinical trials, ignoring research that contradicts experience, integrating research findings into client care, following only old textbooks. Evidence-informed practice involves using the best available evidence to guide care. Question 12. A client with COPD is receiving oxygen. What is the typical flow rate limit to avoid suppressing respiratory drive? 1 to 2 L/min, 5 to 6 L/min, 10 L/min. No limit. High oxygen concentrations can suppress the hypoxic drive in some COPD patients. Question 13. The PN is caring for a client with a stage 2 pressure injury. What does this look like? Intact skin with non-blanchable redness. partial thickness loss of dermis, blister or shallow ulcer, full thickness tissue loss with visible fat, full thickness tissue loss with exposed bone. Stage 2 is characterized by partial thickness skin loss involving epidermis or dermis. Question 14. A PN is asked by a physician to perform a task outside their scope of practice. The PN should perform it under the doctor's supervision, refuse and explain the limitation of their scope, ask a colleague to do it, try it if they feel confident. Nurses must never perform tasks outside their regulated scope of practice. Question 15. Which lab value is most concerning for a client on warfarin, Coumadin? INR 1.0, INR 2.5, INR 5.0, 0.12 seconds. An INR of 5.0 indicates a high risk of spontaneous bleeding. Therapeutic is usually 2.0 to 3.0. Question 16. The nursing process consists of which steps in order? Assessment, diagnosis, planning, implementation, evaluation. Diagnosis, assessment, implementation, planning, evaluation. Assessment, implementation, evaluation, planning. Planning, implementation, assessment, evaluation. ADPI is the standard acronym for the nursing process. Question 17. A PN finds a client on the floor. After assessing the client, what is documented in the incident report? Subjective opinions on why the client fell. The fact that the client was found on the floor. That the floor was slippery. Nothing if there is no injury. Incident reports should contain only objective, factual observations. Question 18. Which position is best for a client experiencing shortness of breath? Supine, prone, high Fowler's, Sims. High Fowler's, sitting upright, allows for maximum lung expansion. Question 19. The primary purpose of the PNRE is to rank nursing students, ensure entry-level nurses are competent to protect the public, provide a license for life, test advanced medical knowledge. The exam's goal is public protection by verifying entry-level competence. Question 20. In Canada, which document outlines the standard of practice for nurses? The Criminal Code, the Provincial/Territorial Regulatory Body Guidelines, the Physician's Handbook, the Hospital Policy Manual. Regulatory bodies define the standards and scope of practice for the profession.